Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County here in Oregon. And today is our COVID conversations for September 15th, 2022. We don't have a guest today, but we have three excellent questions that are going to take some time. So if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. They're on the screen. And we'll get to them the next time. We have three excellent questions today, and we will get to those. So the situation in COVID in the world is that the number of cases is low and stable. There's no real hotspots in the world. Places in Asia that have had the most disease are starting to peak and come down. There is a little bit more disease in Russia than there had been before, but the rest of the world is pretty quiet. The US, similarly pretty quiet. There's a little bit of increased disease in West Virginia, but pretty much the US is quiet. In Oregon and in Douglas County, we've seen this very slight rise in the number of cases in the last week, but that may be related to Labor Day weekend and more travel, but really nothing high. Our number of hospitalizations is very low. In fact, this week we had a time where there were no active COVID cases in the hospital. There were 3 people in the hospital with COVID, but none were actively ill from COVID. So we're doing pretty well on what's going on. The best news in the world is that there does not seem to be a successor variant to the BA5. So the BA5 is basically what has swept through the world, very contagious. You can certainly get this even if you've been vaccinated or had previous disease. But if you've been vaccinated or had previous disease, you don't seem to get very sick or get hospitalized. So over the last month or so, almost all of our hospitalizations for COVID have been people who have been neither vaccinated nor had the disease before, and almost all of our deaths in that same situation. So it does seem that either having had the disease before or having been vaccinated gives you pretty good protection. However, for those people who are neither vaccinated nor had the disease before, we're still seeing some deaths, and we had 2 more deaths this week. So really the recommendation is if you have not had the disease before and have not been vaccinated, please go ahead and get the vaccine. So 3 questions today. Mom asked me about getting the COVID vaccine for her kids. She said, well, kids don't get very sick. Why do they need this vaccine? And I think that's a good question. So when we take somebody my age, a senior, the risks of the vaccine are small and the benefits are huge. Again, when we look at our number of deaths and the number that were vaccinated versus those who were not vaccinated, it's just striking. It's just striking how much the vaccine is protective against hospitalization and death. So for my age, it's incredibly clear. Benefits are huge. The risks are quite small, I think. And weighing those two together, it's clearly in favor of vaccination. When you get to kids don't get as sick from this disease. So, in Douglas County, we've had thousands of kids who have the disease. We've had a couple of hospitalizations. We had one teenager who was really quite sick in the ICU. Deaths in kids are rare individually, although in the country, there have been many hundreds of deaths of kids from the disease. And what we are seeing is that kids who have the disease much more likely have long COVID. And so almost every day in the office, we're seeing kids who have long COVID. And that is, they've had COVID and now they're having troubles breathing, troubles getting a deep breath in. The sense of I can't quite get a deep breath is really pretty prominent. I had a kid in the office the other day that had been going on for almost a whole year. The brain fog and the sleepiness that kids get after are really quite significant. And then there's this rare Miss-C syndrome that we have in kids. Now, what about the risks? Well, we certainly know in teenagers and young adults, there was this myocarditis, but you get myocarditis from the disease also, and you're actually more likely to get it from the disease than from the vaccine. So while you do have to take into account the myocarditis, I think the risk is higher for myocarditis if you get the disease. And with BA5 out there, which is so contagious, it's very likely you're going to wind up getting the disease. So I think when you put all of those things together, the benefits versus the risk in kids are still way in favor of doing the vaccine down even to 6 months. And so we are recommending it. But, with all vaccines are voluntary. This vaccine is not going to be required for school or daycare attendance or anything else. So, my suggestion would be get it. My suggestion for my grandkids is to get it, but the uptake has been low. Maybe only 10 or 20% of kids in that age group in Douglas County have gotten that vaccine. But it still is a good vaccine. I think the booster is going to be a great vaccine. And the second question is, how come the booster didn't have a placebo-controlled trial? So when they did the first vaccine studies for Pfizer, Moderna, and J&J, they had control groups. So some people got the vaccine, some people didn't get the vaccine, and then they looked to see how they did. And the vaccine was shown to be very effective. And when they looked at side effects, it looked like the side effects in the or events that happened in the placebo and in the vaccine group were pretty similar, so suggesting it worked. Now what they've done is they've changed the active component of this from the ancestral strain to a combination of the ancestral strain and the Omicron strain, and are giving it. Now, it has been tradition in this country when the only thing you change is the strain of the virus, that no new studies are required. So every year, for example, there's a change in the flu vaccine. And when there's a change in the flu vaccine from a Sydney to a something else, they don't require new studies. And so there's a little bit of concern, I think, in the media that there were not double-blinded studies on this. But I think the reasoning is sound. Side effects that you're going to see are generally related to the class of vaccine rather than the individual germ that's in it. So I think it was reasonable to go ahead and approve this booster without doing long-term studies. That would delay by 3 or 4 months its introduction. So far, the booster's here. It's here in Douglas County. We've given some, and people have done very well with it. So we're going to be having some events. There's going to be one at the Douglas County Emergency Preparedness place, which is on Diamond Lake in the old Colorcraft building, sort of next to where Kowloon's is and cat a corner from where Abby's Pizza is. It's going to be starting next Monday, going from 1 until 6 through the end of the month. And the state and Douglas County are working together to go ahead and provide booster vaccines for anybody who wants them. So I would do that. If we have listeners in Reedsport, there's going to be a similar one in Reedsport. The days are a little more complicated there, but look out for those and you'll be able to see that. And the third question we had is, you remember back in the early parts of the pandemic, we compared Douglas County with 3 other similar counties across the country. So there was Lowndes County in Georgia, Pennington County in South Dakota, and Twin Falls in Idaho. And what we saw during there is that we had different kinds of patterns. So early on, Lowndes County really had a lot of disease. Pennington had a lot of disease after the Sturgis rally. And then Twin Falls has had up and down disease. When we look now further out, we see that all did about the same. So when you adjust for age, the death rates in all those areas is about the same, but we got here in somewhat different ways. Turns out that in all of these areas, we had relatively low vaccination rates in comparison to the country as a whole. And that is probably why each of these areas has a relatively high COVID death rate, but it looks like we're all at about the same stage now, which is that we've been through those surges. There's a lot of immunity in the population, both from disease and vaccine, and that I think we're like the rest of the country, getting mostly through this. Now, the big concern. There are 2 big concerns. One is that it's pretty clear now that either the disease or the vaccine only give you limited immunity. And so sadly, we're seeing now people on their 4th case of COVID. And each of those times they were diagnosed, they got better, and then they got sick again. And so having the disease does not seem to protect you from getting it again. Similarly, we have a number of people who are vaccinated and boosted who are getting the disease again. Now, if you've had the disease before and getting it for the 4th time, you don't get that sick and usually wind up getting hospitalized. Similarly, if you're boosted, we're seeing very few of those people hospitalized. So having the disease before does prevent against serious disease, but certainly doesn't prevent against disease overall. And the concern is that if there's another spike of disease in October, November, when immunity starts to wane, that it'll pick off those people who were not yet vaccinated nor have had the disease before. And there's only about 5 or 6% of the county who fit in that situation. But I can tell you, when they get the disease, they seem to really die at a high rate. So certainly go ahead and get the vaccine. One of the sub questions was, well, why should I just get the disease? Well, the problem is if you get the disease, you get sick for a week, and most people do get sick for a week. So on the 3 questions, pediatric vaccine, I would certainly recommend you get it, but please talk to your doctor about it. About the boosters and not having double-blinded tests, I think that is perfectly logical and reasonable, and I would recommend that everybody 12 and above get a booster, and we're going to have this booster site here in Roseburg. And then on the doppelgangers, it turned out that in the end, all of the communities did about the same, but in very different ways. So we got to the ends in different ways with peaks in different times. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you.